Good afternoon, Dr. Kimball and fellow classmates. It's great to be with you via video. I downloaded the informed consent document from Central Iowa Psychological Services, also known as CIPS, which is a very comprehensive document and fulfills most of the recommendations given in the ACA Code of Ethics and much, much more. According to Somberg, Stone, and Claiborne in their 1993 APA PsychNet article entitled Informed Consent, Therapists' Beliefs and Practices, clients need adequate information about the counseling process in order to have the kind of freedom they need to make really good and informed choices and to protect their autonomy. CIPS articulates this really well in their consent form. The CIPS consent form also reflects the ACA code by describing the variety of therapeutic approaches based on the client-therapist personalities and relationship, and the collaborative effort to establish a treatment plan. However, the ACA code encourages counselors to make sure the client understands the implications of a potential diagnosis, and CIPS does not cover that in their form. They do, however, invite questions, are very open in the client's opportunity to revoke the agreement at any time, reflecting the ACA code about the client's right to enter and remain in and remove themselves from services at any time. The ACA code also directs counselors to inform clients about the limitations and risks of therapy and the possible benefits, and the CIPS form actually gives a lot of examples of what those risks might be and those benefits might be, which I thought was very helpful. They inform clients about the length of sessions, fees, billings, procedures for cancellations, no-shows, and even the use of insurance and how that all works. They also provide instruction for clients in the event of an emergency, where to call, what numbers, and something that I did not find in the ACA codes. In accordance with the ACA code, CIPS covers the limits of confidentiality, including situations where no authorization is required, such as administrative staff, insurance companies, the duty to warn, and even some legal proceedings that might take place. They also cover ACA code regarding the role of technology and caution clients on the use of email and faxes. CIPS adheres to Principle A2D in the codes to inform minors and their parents about the law that may allow parents to examine their child's treatment records, and so CIPS goes a bit further with that and seeks an agreement from both the child and the parent in the disclosure information. The CIPS service agreement appears to align well with state laws and regulations. According to the Iowa legislator laws and rules that govern behavioral health, section 147.137, a consent in writing must be provided, including the general nature and terms of procedures used by the healthcare provider, potential risks involved, opportunity for questions, and a client signature. CIPS includes all of that opportunity in their consent form. They also meet the state requirement for HIPAA and PHI in accordance with the Iowa Health Network Law 135D2, and also provide the opportunity for the client to decline the exchange of their information if they choose to do that. Although the CIPS service agreement is fairly exhaustive and covers a lot of bases, I wonder if it might be too much for the client and the therapist to read through in that initial session, and if it might even hinder the therapeutic process, especially if the client comes in and maybe in a place of severe depression or crisis or trauma, just questions about that. It seems that a good consent form should be thorough and yet simple, so as to not overwhelm the client with too much information, which actually leads to my question: how do you cover all the necessary legal and ethical requirements in your informed consent without overwhelming your client in that first session? Thanks so much.